So I'll knock on my patient's room, he'll let me enter. I do my hand hygiene, I'll introduce myself. Good afternoon, my name is Claudia. I'm going to be your nurse for today. And for today's assessment, we're going over our abdominal assessment. So I'm going to start off by asking my patient 2 questions. My first question is, have you had any recent changes in appetite at all?
No, I don't think so.
Okay. Have you had any abdominal pain recently?
Nope.
Okay, so that's good. Our next part of our assessment, I'm going to inspect our abdomen. So I'm going to have my patient lay flat.
Alright, no problem.
And so first I'm going to inspect my contour of my abdomen. So I want to get nice and low so I can see my contour, and I can see that my abdomen is nice and flat. After that, I'm going to check the symmetry, so I'm going to get to the foot of the bed, and right here I'm checking symmetry, so I want to make sure that the abdomen is nice and symmetrical, which it is. So after we check our symmetry from the foot of the bed, I'm going to go over and check the patient's umbilicus, and it should be in the midline. My patient's umbilicus is inverted. There's no discoloration, there's no drainage, no inflammation. So umbilicus is looking good. While I'm here, I also want to note my patient's pigmentation. So the skin is nice and pink. There's no signs of any pallor or cyanosis. I'm also looking for any moles or uneven moles. I'm checking for any scars or lesions, any masses. But it looks like my patient's abdomen is nice and clear. The skin is clean and intact, so that's good. I'm also going to take a look at any movements or palpations. My patient has normal respiratory movements. If we take a look at our apical pulse here, we can see it slightly palpating, which is normal. If we look over at our lower abdomen, I see no waves of peristalsis, which we normally wouldn't see any movements unless our patient is extremely thin. So that's looking good. After that, I'm going to go on to my auscultation portion. We don't want to palpate right after because we don't want to add any additional bowel sounds. So I'm going to go ahead and I'm going to auscultate all 4 quadrants of my abdomen with my diaphragm of my stethoscope. So I'm going to clean off my diaphragm. I'm going to put on my stethoscope, and again I'm listening in all 4 quadrants, making sure that I'm hearing active bowel sounds. My patient's bowel sounds are nice and active. There's no hypo or hyperactivity. Usually with absent bowel, or if we suspect any absent bowel sounds or hypoactivity, we would listen in each quadrant for 5 minutes, but our bowel sounds are normal. After we auscultate all 4 quadrants, I'm going to auscultate my vascular areas or my vascular sounds. So this we want to do with the bell of our stethoscope. So I'm going to go ahead and clean off the bell of my stethoscope. The first area I'm going to auscultate is my aorta, so we can find that 2 inches above the umbilicus. So I'm going to auscultate that. And then I'm going to auscultate my renal artery, which is just at the same level of the aorta. It's just slightly to each side of it. So I'm going to listen to the renal arteries on each side now. My other one. And again, we're pressing gently so that we're not adding any additional sounds. After our renal arteries, I'm going to auscultate my iliac arteries, and that's just an inch below our umbilicus and slightly to the side. And again, I'm listening to both iliac arteries. So normally we should not hear any sounds. I did not hear anything in my vascular sounds. If there is an abnormal sound, we would hear a bruit, but like I said, there are no sounds coming from my vascular areas. So after we're done auscultating, I'm going to go to my palpation portion of the assessment. So I'm going to start with my light palpations on the patient's abdomen. I'm going to put my fingers together and I'm going to press them just flat against the patient's stomach. And I'm going to be pressing, for light palpations, we're going in about 1 centimeter, and we're going in gentle rotary motions. And we're looking for any lumps, bumps, tenderness. And I would also leave the painful area of the abdomen last for palpitation because we don't want to irritate the patient. Okay, and again we're doing all over the abdomen. And just by feeling the abdomen, I can tell that my abdomen is soft. There were no palpable masses or rigidity felt. There was no tenderness. My patient stated earlier that he had no abdominal pain, so I didn't have to leave any of the areas to palpate last. And then lastly, I'm going to do my deep palpations. And again, I'm going to have my fingers together and flat across the abdomen or against the abdomen, but this time we're going in 5 to 8 centimeters. And we're still doing gentle rotary motions, just in a little deeper. My patient can breathe normally. And just let me know if you feel any pain or tenderness while I'm palpating. And again, we're checking all over the abdomen. We're palpating deeper and leaving any painful areas for our last palpations. Any pain or tenderness?
Nope.
No, okay. So after my deep palpation, again, the abdomen was nice and soft. To palpate, there were no palpable masses or lumps and no rigidity that was felt. Thank you for watching my video.